Declining health status, anxieties, financial concerns, fear of changing roles in life, and just navigating the healthcare system. These and a multitude of issues face those people dealing with advanced illness and end-of-life care.
Well, it's probably one of the hardest things that you'll do in your life.
Well, you take a day at a time.
It was tough. It was really, really tough because I feared every minute I was away from him that something was going to happen.
Just not knowing who to call or what to do, and we see people landing in the emergency room or sometimes hospitalizations, and they just go from one crisis to another.
This physical and emotional suffering that caregivers, patients, and families go through in advanced illness and end of life is often not recognized or even acknowledged by healthcare providers. A hospice program is designed with this need in mind, to offer medical, emotional, and spiritual care for the terminally ill.
Hospice care is the care of people in their last days, weeks, and months of life. We at hospice like to think that we help them live the best they can until they die.
Making sure that we respect their wishes as much as possible, whatever that is, whether it's I want to remain at home if I can, or I want a hospital bed in my home, or I don't. You know, it's the little things that you really try to help people relieve their suffering.
So what hospice does is they take you in their control, but they don't force you. And they make you feel as comfortable as you can be. And you're so happy that they are there, and they just give you the moral support, the physical support, everything you could ask for.
There are also ethical dilemmas related to end-of-life care. When do you withhold or withdraw life-sustaining treatment? When should treatment be considered futile? These and other issues are common concerns addressed by today's hospice workers and are critical factors in healthcare today with our aging population.
So helping them to be as comfortable as possible, but also educating them on what is the illness, what to expect, you know, what might be some choices for them, clarifying goals that they might have as far as the care, and then helping people make decisions.
You know, not to feel guilty and things like that. They tell you what to look for as they get closer to the end of life, and they just provide so much help, you know, emotionally, spiritually, and materially.
She just controlled the situation, but very peacefully, told us what they were going to do, how they were going to do it, and that hospice was not just for people who were going to die, it was going to be for everybody, and many of them do recover.
Hospice care is now the fastest growing provider in the Medicare system, and our aging baby boomer generation faces a growing need to be more proactive in recognizing the needs of advanced illness, so they will know how to access the services to meet those needs. Since 1981, Hospice of Siouxland has embraced these needs through consumer, physician, healthcare provider, and community education.
What can we do to help you? How can we help you? It's keeping them comfortable, helping them meet their goals of care. What do you want to happen? What don't you want to happen?
As a joint ownership program of 2 hospitals in the Sioux City, Iowa area, Mercy Medical Center and St. Luke's Regional Medical Center, Hospice of Siouxland provides care and support for the terminally ill at home as well as in inpatient medical facilities. Its hope is to help families embrace hope.
But it's really taking away some of the stressors that allows people to be comfortable and live their life fully. And it happens all the time.
Through its community-based palliative care program and its program of all-inclusive care for the elderly, Hospice of Siouxland strives to help patients and families live their final days to the fullest.
If you feel like you've been able to help people to be comfortable and you've made these last weeks and months and days easier, and you've really made a difference.
I would recommend hospice because I think they're the best in the world. I get a little emotional about this, but for what they do and how they do it, they can't be beat.
Because they're there for you emotionally, and physically.
None of us in hospice like to hear there's nothing more we can do. We know what the doctor means. There's nothing more we can do to cure your disease. But I half-jokingly say, if I'm dying and somebody tells me there's nothing more they can do, I want a different doctor, because there's lots of things we can do. We can keep you comfortable. We never give up hope. We kind of change hope from a cure to hope for comfort, hope for dignity, you see. And then we can treat those symptoms aggressively.
We believe as a team that we've been blessed because we've had an opportunity to do this kind of work. And honestly, it changes how you look at life. You know that life can change, and it forces you to look at your own mortality. And that's a gift. That's truly a gift. My life is lived differently because I've done hospice than it would be if I hadn't.
For more information on Hospice of Siouxland, call 712-233-4144 or visit hospiceofsiouxland.org.